The World Health Body, or WHO, has recently classified Mpox as a global public health emergency. This comes after a surge in Mpox cases in the Democratic Republic of Congo in Africa, which is now spreading across parts of Central and East Africa. The highly contagious disease, which was earlier called monkeypox, had killed at least 450 people during an initial outbreak in Congo. At least 99,000 cases and more than 200 deaths due to monkeypox have been reported from over 116 countries since the year 2022, according to data by the WHO. Currently, scientists are concerned about how fast a new variant of this disease is spreading and its high fatality rate. The risk assessment of the virus spreading mostly in children through multiple modes of transmission has also been considered to be high. As for India, while no case has been reported so far, the risk continues owing to travel. We have a couple of special guests now joining us for more. We have Dr. Sharad Kumar Agarwal, former National President of Indian Medical Association, now joining us on the broadcast very soon. We are trying to understand whether you should be worried about Mpox or not, especially in the light of a new variant that's spreading very fast already. Sweden has announced that the virus has hit the shores of Sweden as well, even as it first began in Africa. Pakistan has also confirmed its first case of Mpox, and it has been declared as a public health emergency by the World Health Organization. Let's quickly get in some reactions first.
Välkomna hit idag till denna. Vi har också nu under eftermiddagen fått bekräftat att vi har ett fall i Sverige av den allvarligare typen av Mpox, den som heter clade 1. Det är förstås någonting vi tar på allvar. Samtidigt är det här ett arbete som hälso- och sjukvården och de regionala smittskyddsenheterna kan och har upparbetade rutiner och system för att hantera. Den tillförordnade generaldirektören Olivia Wigsell för en närmare redogörelse för läget. Folkhälsomyndigheten samordnar arbetet på nationell nivå och har nära dialog med de regionala smittskyddsenheterna.
Vi har en person som har sökt vård i Region Stockholm som har konstaterats ha Mpox orsakad av, som vi hörde, virusvarianten clade 1. Och fallet är det första som är orsakat av clade 1 som har diagnostiserats utanför den afrikanska kontinenten. Den drabbade personen har också smittats under en vistelse i ett område i Afrika där det pågår ett stort utbrott också av Mpox, clade 1. På analyser, vad är det för resandeströmmar det handlar om. Och det personen i Sverige som har bekräftats då vara smittad har fått både vård och förhållningsregler enligt gällande rekommendationer. Och vi bedömer att Sverige har en bra beredskap för att både diagnostisera, isolera och vårda personer med Mpox på ett säkert och bra sätt.
Alla tre kommer finnas kvar för enskilda intervjuer.
And now we have Dr. Sharad Kumar Agarwal, former National President of Indian Medical Association, or IMA, now joining us. So Dr. Agarwal, thank you so much for taking time to be with us here on News9 Live. The question I'm going to ask you is this. Since 2022, already 27 cases have reported from India of Mpox. How dangerous and deadly is this new variant, and how much at risk are we here in India?
See, it is a contagious disease, virus, DNA virus. And in 22, there was an outbreak in Africa, Central, East and West Africa. And at that time also, India was not that much affected. If you can see from, as you yourself said, since January 2022 to June 24, in 2.5 years, India has reported only 27 cases and 1 death. So we can understand that the magnitude is not that much. It is mainly on the African countries and small nearby countries. Pakistan has reported many cases. So my advice is to be vigilant, but don't be panic. And it is not that worse in India. And when it will come, we'll see, because We don't require to prepare any extra thing. So what we have, I think we are able to handle the problem if it comes.
Right, but the fact of the matter is that the concern these days, wherever an outbreak is the amount of travel. Certain states in India, say from Kerala, there's so much of outbound travel across the world, and that makes India that much more vulnerable.
Yes, definitely. But see, we were vulnerable in 2022 also. That is why I'm saying, if you see it, there is a world outbreak by the WHO. WHO declares international, infection and outbreak in January 2022. And if in 2.5 years, in spite of all these international, incoming footfall in Kerala and in Mumbai, we still have only 27 reported cases. That is why I am saying that we have to be vigilant, but not to worry and not to be create any panic.
Okay. Now, there is no need to panic at this point in time. But you do understand that we live in the post-pandemic world, the post-COVID world. Do you think that it is time already, without panicking, for Indians living in India to start taking certain precautions?
Absolutely, absolutely. See, during COVID, we understand what is the normal attire whenever you have any contagious disease or even a viral infection, the common cold. So, if somebody is having this kind of problem, basically the skin lesions. In this monkeypox, the primary symptom is the skin lesions and membranous mucosal membrane lesion with some fever, headache, and body ache. So whenever you feel these kind of symptoms, the person should not coming in the crowded area. They should confine or isolate themselves. And whenever they are coming out in the public, they should wear a tight mask as we were doing during COVID. And second thing is that they should cover if there is any lesion or on the skin, they should cover it. The other thing is that we should know how it progressed, how it is spread. It is spread through touching the infected surface. So whenever we go outside, touch outside surface, we again what we do during COVID, the normal attire, washing your hand, putting mask, making distance, don't go in the crowded area. And if you are infection, if you think that you are infected, then you should be confined yourself in isolation. That are the precautions we should take, and we should definitely inform our doctor, because diagnosis is very difficult for the monkeypox, because the symptoms, they resemble lot many infections, and it is only diagnosed by PCR. The sample is taken from the lesion, skin lesion, or from swab, like we were doing during COVID. The throat swab or any anal or genital lesion swab, that has to be going for the PCR, and then only the diagnosis is confirmed. So I think at present we should be vigilant and following the normal behavior, the universal protection behavior, UPP, that we have to follow.
Right, Dr. Sharad Kumar Agarwal there giving us that perspective on the recent upsurge in Mpox cases. Bear in mind, the World Health Organization has declared it as an emergency of international concern. That's the term that has been given. It's the second time in 2 years that the emergency of international concern tag has been given to Mpox. There was an outbreak between July 2022 and May 2023 as well, when it was declared by the World Health Organization, the Public Health Emergency of International Concern, or PHEIC. And now again in 2024, the August of 2024, the World Health Organization has again called the Mpox outbreak in Africa a public health emergency of international concern. Dr. Agarwal, it is a public health emergency of international concern. That's the term that is given by the World Health Organization, second time in 2 years. There are vaccines that can prevent Mpox, isn't it?
There are vaccines, and they advise that after the symptom up to the 4 days, or if there is no symptom post-infection up to 14 days, a person can take vaccine and be benefited. But again, this is for those countries where the numbers are in huge. Like during COVID, we saw every country was having lot many cases. But if you ask me for India, again I say there is no need rush for the vaccine. There is no need to be panic. Do follow a normal protective mechanism which we have learned during COVID. So in India right now there is no need to going after the vaccination of for monkeypox.
There is no need for vaccination, but do you think that the Indian healthcare system, at state levels and local level, be alerted, especially in states where there's so much of international travel? You have Sweden now reporting the case, you have Pakistan reporting a case. So in that sense, the public health system needs to be alerted at a national level.
Definitely. As you are raising this issue, it is very important issue, so that we should be knowledgeable. We should know what is happening surrounding to us. And you are very right that the state like Delhi, Maharashtra, Kerala, they should be more vigilant on that, particularly at the airport, so that we should try that the infection should not spread in our country. And that is very important. You are absolutely right.
What can private health facilities do at this stage?
See, for handling this monkeypox infection, private as well as the government hospitals, they are equipped. We don't require so many of oxygenation, ventilation like in the COVID. So it is a infection which is self-limiting unless until going for the complication, which is rare. In this infection, the total time period after infection is 2 to 4 weeks. After 4 weeks, once the lesion, the scabs goes off, so it is out of danger. Yes, but few patients who are having immunity compromised, by suppose having cancer or any kidney disease or obesity or on some medicines which decrease the immunity, they have to take proper care so that the infection should not spread to other part of the body. But otherwise, the government as well as private facility in India, they are capable of handling these kind of infections.
Okay, so as the word coming from Dr. Agarwal, former National President of Indian Medical Association, that both public and private health facilities in India are fully capable of tackling Mpox. That's now reached the shores of Sweden and Pakistan. Dr. Agarwal, my question here at this stage is this: what can individuals do? What can people like you, me, and on those watching can do? Is it time to start masking up again?
No, not at all. Again, I am saying be vigilant, be alert. If you have any, because the symptoms are same what is having during any viral infection, like common cold, the headache, the body ache, the fever. These are the symptoms commonly found in every viral infection. The only thing which demarcate from other infection is the skin lesions or the lymphadenopathy. So if you have any skin lesions with all these symptoms, then surely go for the PCR test, polymerase chain reaction test, where the sample has to be taken from the skin lesion or from the oropharyngeal throat or your any genitalia or anus, if you have any lesion there. That is the only thing. And yes, what we can do, start doing that, like I said before, whenever you go outside, you wash your hands frequently. You try to not to be in a crowded area. and you can make a physical distance. That is maximum we can do and start doing this. But again, I am reverbalizing the thing. Please don't panic.
Okay, definitely. That's the reason why we're doing this show, Dr. Agarwal, to ensure that people are not panicking. What would be your advice to Indians now traveling abroad who have trips lined up in the near future? What are the precautions that they should take?
See, if those who are traveling to these outburst areas, like in Central, East, and West Africa, particularly, uh, ideally they should avoid to going in these countries, if not necessarily. And if they are going, so they already been. They should take the vaccination and then go there. And if they are going into these area, then they should put a tight mask on them and washing their hands, and they can be vaccinated for that monkeypox.
Sharad Kumar Agarwal, former National President of the Indian Medical Association, there helping us understand how to be ready and alert when it comes to dealing with the Mpox scare. Thank you, Dr. Agarwal, for taking time to be with us here on News 9 Live.